4 seeds are quietly damaging your heart, interfering with your medications, and speeding up memory loss right now. And there are 4 others that can do the exact opposite if you're over 60. For years, we've been told that seeds are healthy, natural, anti-inflammatory, heart-friendly, and that advice isn't completely wrong. But for a body that is 60, 65, 70 years old, that advice is dangerously incomplete. Because the way your body processes certain seeds after 60 has fundamentally changed. Your liver detoxifies at a fraction of the rate it once did. Your kidneys filter more slowly. Your inflammation pathways respond differently now. And certain compounds inside perfectly ordinary seeds, compounds no one warns you about, can silently accumulate inside an aging body and quietly start working against you. I say silently because that's the part that matters most. You won't feel it the day it starts. You won't wake up and connect it to a seed. Instead, you'll notice your blood pressure numbers creeping up even though you're on medication. You'll notice your joints feeling stiffer in the morning than they did a year ago. You'll feel a tiredness that sleep doesn't fix. Maybe your memory feels slower. Maybe your digestion has become unpredictable. If any of that sounds familiar, and I hear it from patients every single week, I want you to know something right now. You are not imagining it. And the answer may be hiding somewhere you would never think to look. My name is Dr. Michael Kent. I practiced internal medicine for over 30 years, and here's what troubles me most as a physician. No one is telling you this. In a 12-minute appointment, your doctor is not going to discuss which specific seeds interact with your blood pressure medication. The label on the bag doesn't warn you about compounds that interfere with your cholesterol drugs or your blood thinners. And the health articles you find online are written for a 40-year-old body, not yours. That gap right there is exactly why I made this video. Before we go any further, if you've ever said to yourself, I'm doing everything right and I still don't feel right, comment the words, "Me too," below this video right now. Just those 2 words, "Me too." I read every comment personally, and I will respond to yours with something specific to what you share. You are not just a viewer to me. Now, here is the good news, because there is real good news. For every seed I'm going to ask you to reconsider today, there is another one, often cheaper, easier to find, and more powerful, that can do the exact opposite. Support your heart, protect your brain, calm the inflammation that has been building quietly for years, and actually help your medications work the way they're supposed to. So stay with me through this entire video. Both lists matter equally. Let's start with the 4 seeds your body will thank you for. Number 4, and this one surprises almost everyone I mention it to. Flaxseed. Most people, when they think omega-3, think fish. Fish oil capsules, salmon, and fish-based omega-3 is powerful, but a significant number of the seniors I've treated over 30 years don't eat fish regularly. Some can't tolerate the supplements, and many have simply never been told there's a plant-based source of omega-3 that delivers comparable anti-inflammatory benefits for almost nothing. Flaxseed is one of the richest sources on Earth of a fat called ALA. Your body uses ALA to calm the chronic low-grade inflammation that drives heart disease, joint pain, cognitive decline, and arterial stiffening. That inflammation is not something you feel dramatically. It's quiet, it's slow, and it's doing damage while you go about your day. But flaxseed doesn't stop at omega-3. It contains plant compounds called lignans. And a study published in the Journal of Clinical Oncology found that women after menopause who consumed lignans regularly had significantly better cardiovascular outcomes than those who didn't. It also contains soluble fiber that slows glucose absorption into your bloodstream. If your doctor has ever mentioned pre-diabetes or told you to watch your numbers, that benefit matters in ways most seeds simply can't deliver. Here's the one thing I need you to remember. Buy it ground, not whole. A whole flax seed passes through your body completely undigested. The shell is too tough to break down. Ground flax seed, 1 tablespoon stirred into your oatmeal or yogurt in the morning, delivers every bit of that benefit in 10 seconds. Store it in the refrigerator after opening because the oils go rancid at room temperature. 1 tablespoon every morning. That is the entire protocol. Research supported, inexpensive, and already compatible with almost anything you're eating right now. Flaxseed is the easiest seed upgrade you will ever make. Number 3. Pumpkin seeds. And I want to say up front that pumpkin seeds may be the most clinically undervalued seed in senior nutrition. I almost never hear them mentioned in mainstream health content. That's a problem, because for men and women over 60, the specific combination of nutrients inside a pumpkin seed directly targets the complaints I hear most often in my office. Let's start with sleep. After 60, your body produces significantly less melatonin, the hormone that regulates your sleep cycle. Most people respond by buying supplements, but pumpkin seeds contain tryptophan, an amino acid your body converts naturally into serotonin and then into melatonin. A small handful in the evening can support deeper, more restful sleep through your own biology, without a pill, without a prescription. That is not a small thing. For men specifically, and this is something most nutrition content completely ignores, pumpkin seeds contain zinc and plant sterols that have been shown to reduce the symptoms of benign prostate enlargement. A study published in the Journal of Medicinal Food, taking pumpkin seed oil, and found significant reductions in nighttime urination and urgency over 12 weeks. These are quality of life issues that affect the majority of men over 60 and that many men accept as simply part of aging. They don't have to be. For women, pumpkin seeds deliver magnesium, one of the most critical minerals for bone density at a stage of life when bone loss accelerates. And magnesium deficiency, which affects more than half of adults over 60, is also linked to muscle cramps, anxiety, irregular heartbeat, and elevated blood pressure. Food-based magnesium absorbs more gradually than supplements and doesn't cause the digestive disruption that magnesium pills often trigger. 1 ounce of raw, unsalted pumpkin seeds per day, on a salad, in a soup, as a snack. Skip the salted packaged versions. The sodium erases much of the cardiovascular benefit you're trying to build. Sleep, prostate health, bone density, blood pressure. 1 small seed, 1 ounce a day. Number 2, sesame seeds. And I want to start here with something that will completely reframe how you think about bone health. Most people believe bone strength comes from dairy, milk, yogurt, cheese, and dairy does provide calcium. But 1 tablespoon of sesame seeds contains more absorbable calcium than a full glass of milk. Here is the critical difference. Sesame seeds deliver that calcium alongside magnesium and zinc, the 2 minerals your body needs to actually build bone matrix. Without those coactors, calcium alone doesn't know where to go. It can drift into your arteries and contribute to calcification rather than protecting your bones. This is one of the most important insights for anyone over 60 trying to protect their skeleton and their heart at the same time. Sesame seeds do both simultaneously because the nutrients are in the right ratio to work together. Beyond bone health, sesame seeds contain a compound called sesame, unique to sesame. And research published in the Journal of Nutritional Biochemistry found that sesame lowers blood pressure by directly reducing tension in arterial walls. That is not a mild effect. For someone managing hypertension, that is a meaningful food-based contribution to the same goal their medication is working toward. Sesame seeds are also rich in vitamin E, which protects brain cell membranes from the oxidative damage that accumulates with age and is directly linked to memory decline. The easiest form is tahini, ground sesame paste, 1 tablespoon on whole grain toast, stirred into a salad dressing, mixed into soups. You barely taste it, but your bones, your blood pressure, and your brain are all receiving something they need. 2 tablespoons a day is your target. Choose whole sesame seeds or tahini for maximum absorption. Whole unholded seeds are harder for the aging gut to break down. If you are managing blood pressure and bone loss at the same time, and most people over 60 are managing both, sesame seeds are quietly one of the most targeted foods you can eat. 2 tablespoons a day. That's it. And number 1, the one I've been saving because it consistently surprises my patients more than anything else on this list. Pomegranate seeds. When most people hear the word seeds, they picture something dry from a bulk bin. Pomegranate seeds are different. Those bright red arrows inside a pomegranate are among the most medically potent foods in human nutrition. And I do not say that lightly. Pomegranate seeds contain compounds called punic agents unique to pomegranate found nowhere else. Research has shown these compounds reduce inflammation directly inside the arterial wall. They lower LDL oxidation. That is the process that turns cholesterol from a passenger into a problem, and they improve blood flow to the heart. A landmark study at the Preventive Medicine Research Institute followed patients with documented coronary artery disease who consumed pomegranate daily. At the end of 1 year, those patients showed measurable reversal of arterial plaque accumulation, not slowing of progression, reversal. For the brain, pomegranate's polyphenols can cross the blood-brain barrier, something most antioxidants cannot do, and calm the neuroinflammation linked to Alzheimer's disease and cognitive decline. Research published in evidence-based complementary and alternative medicine found that older adults who consumed pomegranate daily showed significant improvements in verbal and visual memory tasks within 28 days. 28 days. And here's a practical note. If you are on statin medication for cholesterol, pomegranate can interact with those drugs similarly to grapefruit by affecting the enzyme your liver uses to process the medication. This does not mean avoid it. It means mention it to your physician so they can monitor your levels. That one 30-second conversation is worth having for everything this seed can do for your heart and your brain. And your fresh pomegranate seeds, a few ounces daily, are ideal. When they're out of season, 100% pomegranate juice with no added sugar delivers comparable benefits. Skip the supplement capsules. The research is built on the whole food. Arterial inflammation reversed. Memory sharper in 4 weeks. Blood flow improved. If you add only one thing from today's video, let it be this. Now, I've spent the first half of this video giving you things, seeds that your body at 60, 65, 70 can genuinely use to get stronger. I want that information to stay with you, but I would not be the kind of physician I've tried to be for 30 years if I didn't also tell you about the seeds that are quietly working against you, the ones that carry risks that almost no health content ever mentions. Not because they're inherently dangerous, but because the way they interact with an older body's chemistry, and particularly with the medications many of you are already taking, is something you deserve to know. So, let's talk about the 4 seeds I want you to reconsider. Number 4, and this one will surprise you because it has a reputation as a healthy snack, commercially roasted sunflower seeds. Before you stop me, raw, unsalted sunflower seeds do provide real benefits. The seed itself is not the problem. The problem is what happens to it on the way to the store shelf. Commercially roasted sunflower seeds are almost always processed in industrial seed oils, oils extracted under high heat that are already oxidized before they even touch the cooking process. When those damaged fats coat your sunflower seeds and then get heated again during roasting, you end up consuming a significant load of oxidized fat that promotes inflammation directly in the arterial wall. Here's why this matters more after 60 than at 40. Chronic arterial inflammation, quiet, invisible, ongoing, is the mechanism behind atherosclerosis. It is the engine that builds plaque. And the refined oils used to roast commercial sunflower seeds are, according to cardiovascular researchers at the University of California, one of the dietary contributors to exactly that process in aging adults. On top of that, most commercially packaged sunflower seeds contain more than 300 millimoles of sodium per serving. For someone managing blood pressure, that sodium load is working directly against the benefit you thought you were getting. I am not telling you to avoid sunflower seeds. I'm telling you to buy them raw and unsalted. 1 ounce of raw sunflower seeds delivers vitamin E, magnesium, and selenium without the damaged fats and excess sodium. Read the label. If it says roasted in oil, put it back. The seed is not the problem. The processing is number 3, and this one connects directly to something I mentioned in the very first minute of this video. Chia seeds. And I want to be careful here because chia seeds used correctly are genuinely beneficial for older adults. But used incorrectly, there are 2 specific risks I have seen cause real problems in my practice. The first is a swallowing risk. When dry chia seeds contact moisture in your throat or esophagus, they begin forming a gel almost immediately. For adults with any difficulty swallowing, which becomes more common after 60 and is very common after a stroke or any neurological event, dry chia seeds can form a partial obstruction in the esophagus. This is documented in medical case reports. It can require emergency intervention. It is a real risk. The second issue involves blood pressure medications. Chia seeds genuinely lower blood pressure. That benefit is real. But if you are already on antihypertensive medication, adding chia seeds daily creates a compounding effect your medication was not calibrated for. Your blood pressure can drop lower than intended, and for older adults who already experience that dizzy drop in pressure when standing up quickly, that combination increases your fall risk in a way I take very seriously. Falls are the leading cause of injury-related death in adults over 65 in this country. That is not a theoretical concern. The fix is simple. Always soak your chia seeds before consuming them. 2 tablespoons in water for at least 20 minutes. The gel is already formed, so there is no swallowing risk. Tell your physician the seed is not your enemy. Dry consumption and unmonitored introduction are number 2. Flaxseed when consumed in excessive amounts. I know I recommended flaxseed at number 4 on the good list. I stand by that completely at the right dose. But flaxseed is one of the clearest examples of a seed where the difference between beneficial and harmful is entirely about quantity. 1 tablespoon of ground flaxseed daily is beneficial. 3, 4, 5 tablespoons, which some wellness websites actively recommend, is where problems begin. Flaxseed contains lignans that behave like weak estrogens in the body. At 1 to 2 tablespoon amounts, this appears beneficial, particularly for women after menopause. At larger amounts, anyone with a history of hormone-sensitive breast cancer, uterine cancer, or certain ovarian conditions needs a specific conversation with their oncologist before making high-dose flaxseed a daily habit. There is also a blood sugar interaction that most people are never warned about. Research has documented that flaxseed amplifies the effect of glucose-lowering medications, metformin, insulin, and others. The American Diabetes Association has flagged this interaction specifically for older adults because the warning signs of low blood sugar are often blunted after 60. That means your blood glucose can drop into a dangerous range before you feel any signal that something is wrong. 1 to 2 tablespoons per day. That is your safe zone and your optimal zone at the same time. More is genuinely not better. And anyone on blood sugar medication, mention your flaxseed consumption to your doctor at your next visit. 30. Second conversation. It matters. And number 1, the one affecting more people over 60 than anything else I've mentioned today, and the one almost no one is talking about, commercially refined seed oils. These are not sitting in a bowl on your counter, but they are inside almost everything you buy. Canola oil, soybean oil, corn oil, cottonseed oil, anything labeled vegetable oil on an ingredient list. These are extracted from seeds through a process involving high heat and chemical solvents. The result is chemically different from the seed it came from, with a massively imbalanced omega-6 to omega-3 ratio and significant amounts of already oxidized fat baked in from the extraction process itself. Here's what those oxidized fats do inside your body. They trigger chronic low-grade inflammatory response in the walls of your arteries, not inflammation you can feel. Silent, persistent, invisible inflammation. The exact kind I described in the opening minute of this video that builds over years and is now understood by cardiovascular researchers to be one of the primary mechanisms driving arterial plaque in aging adults. And here's what troubles me most. These oils are in the salad dressings labeled heart healthy. They are in the whole grain crackers your doctor recommended. They are in the restaurant meals you consider a safe choice. They don't say seed oil. They say vegetable oil. And millions of older adults who are doing everything else right are consuming them in large quantities every single day. There is also a medication angle that almost no one discusses. The severe omega-6 to omega-3 imbalance created by a diet high in refined seed oils directly affects how your body metabolizes certain anti-inflammatory medications, including common drugs for arthritis and joint pain. Research published in the British Journal of Pharmacology has documented that elevated omega-6 levels can reduce the effectiveness of NSAIDs and certain cardiovascular drugs by competing for the same metabolic pathways. The medication your doctor prescribed may be working at a fraction of its intended capacity, not because the drug is wrong, but because of what you're cooking with. I'm not telling you to fear every oil in your kitchen. I'm telling you to make one specific swap. Replace vegetable oil and canola oil in your home, cooking with extra virgin olive oil for low to medium heat and avocado oil for higher heat. That single change may be the highest impact dietary decision you make this entire year, because the seed you are not thinking about may be doing more damage than any of the ones you are. We covered a lot of ground today, and I want you to step back for a moment and recognize something about yourself. You watch this entire video, that means you are not passive about how you age. And in 30 years of medicine, the patients who stayed curious, who asked questions, who made small, intentional changes were the ones who remained strong and sharp and independent for far longer than anyone expected. Your heart, your brain, your bones, your energy, all of it is still responding to what you choose to put into your body. That does not diminish after 60. If anything, each good decision compounds more meaningfully now than it did at 40. The changes happening in your body right now are not a fixed sentence. They are a direction, and direction can be changed. Here is what I want you to walk away with today. Not a complicated protocol. 3 things. Add ground flax seed or pomegranate seed, or both to something you already eat each morning. Replace vegetable oil in your home kitchen with olive oil or avocado oil. And if you are on any prescription medication and blood pressure, cholesterol, blood thinners, blood sugar, bring up what you learned today at your next appointment. One conversation, that is it. Those are not massive changes. But 6 months from now, your body will know the difference. Now, I want to hear from you. Have any of the seeds I mentioned today already been part of your routine? Maybe you've noticed something. More energy, better sleep, better digestion, or maybe you felt something you couldn't explain. Share it in the comments below. Not for me. For the person who is going to read your comment 3 weeks from now and make a better decision because of what you experienced, your story has real value. Use it. Thank you for staying with me through this entire video. That tells me you are serious about your health and you deserve to be taken seriously. If this helped you, please give this video a like so YouTube shares it with someone else who needs it. Share it with one person in your life you care about. And subscribe to this channel if you haven't already. Because every day I put out new research-backed content specifically for people who are done accepting that feeling worse is just what aging looks like. Because here's what I want you to carry with you. Aging does not have to be a story of losing ground. The patients who feel that way are usually the ones who simply haven't been given the right information yet. Now, you have some of it, and information in the hands of someone willing to act on it is medicine. The choices are yours. They always have been. I'm just here to make sure you're making them with everything you need to know. God bless you. Take good care of yourself. You have earned it. And, as always, breathe.